Welcome back, everyone. Dr. Alanzi is with us today. He's a urologist with Lima Memorial Health System. We're talking a little bit about prostate cancer, and obviously June we focus on men's health. Boy, that's a time to think about that. Tell us a little bit about screenings and why that's so important to get that done for men.
Well, thanks for having me today. Prostate cancer is obviously the most common cancer in men after skin cancer. So it is a very common cancer, and screening test is available all the time. So you can just check with your primary care doctor, and that will change your the future for the cancer. Either we can treat it early, get it detected, versus waiting too long and can be more complicated, or we miss a window for treatment.
Yeah, and you've mentioned this before. As you said, it's 100% treatable if you catch it early enough. Are there certain people that might be more at risk? Is there a genetic link there? Maybe we think about our family history.
Absolutely. So the genetics is very important. It plays a major role. So any family history, so a brother or a father or an uncle has prostate cancer and had prostate cancer in the past. African American, they tend to have a little bit more extra chance of having prostate cancer compared to other races. So if you have a family history or African American, we tend to recommend the screening to start a little bit earlier. But as a rule of thumb, in general, we recommend screening about the age of 45. There are different guidelines, but this is what I think based on one of the major guidelines is called the NCCN guidelines. I think that's the most comprehensive guidelines.
You know, other types of cancer, we've heard some of the screenings, when it comes to colon cancer, the age kind of drops a little bit. I know they've gone from 50 to 45. Is that something you look for when it comes to prostate cancer? Have those guidelines changed a little bit over the years?
If they have a significant family history, yes, I usually start around 40. And another major thing is lifestyle, which is we're going to probably talk at the end about, like changes in lifestyle to minimize the risk for prostate cancer.
Yeah, I'm glad you mentioned that because I think so much about diet and some of the diseases that can prevent. Is there a link to what we eat and what kind of diet we've had through the years?
Absolutely. So being on the healthy side, that's just like put it simple. And anything that's good for your heart is good for your prostate. So minimizing red meat, saturated fat, be more on the healthy side as fruits and vegetables and diet. There are some specific things more for prostate cancer. There's studies not as strong, but I think it's useful. And I actually talk to my patient in the clinic about them. Certain fruits, so we're talking about vegetables in general, tomatoes, carrots, soy. These are important luciferous vegetables, so broccoli, cauliflower. It's good to have in your diet. As for the fish, small and medium-sized fish like tuna and sardine, these are like important along with the dairy products. On top of that, good sleep hygiene and exercises. All the studies showed it helps minimizing the risk for prostate cancer. And if you have prostate cancer, actually slow the progression.
And as you said, the key is to get screened. I know men can be a little hesitant, probably more so than women, to go in and get, as we said, health screenings or specifically prostate screenings. Any recommendation you would give them to try to encourage men to come in and get checked?
Yes, especially I would say in the last 7 years, we have many issues with prostate cancer screening. People say, don't do prostate cancer, doesn't kill you. And, what we see in the office and what we've seen since these changes and people discussing it, we've seen more advanced prostate cancer presenting the office. So prostate cancer presenting late for us to miss the window for treatment. So I really encourage patients to come in and screen and talk about it. I have patients here, we go by individual basis. We don't do it as a routine, like everybody gets blood tests every year. No, we talk to patients and adjust the risk based on their age, family history, prostate exam. And I do recommend doing the blood test at least when you reach that age 45 or 50 and go from there. And once you do that, you're good. And if anything happens, we can always take care of it from there.
Yeah, as you said, you guys have the latest technology to do that. If they want to give you guys a call, they can call 419-998-8276 and get checked out and maybe relieve some problems down the road. Thank you so much, Doctor, for telling us about it. We appreciate it.
Thank you. Thanks a lot again for having me.
You bet. Nice chatting with you. We'll be back right after this.